Yeah, it is my pleasure to invite Dr. Kumaran Murugesan, who is a pioneer in this field and has a vast experience in these protocols, operation theater protocols as well. He is a part of NABH team also. Thank you, Dr. Kumaran Murugesan, for being here and teaching us on this, since there is a dearth of information on how to monitor the sterilization or troubleshoot when an event of sterilization failure occurs, what we do, how to do.
Thank you, Dr. Ravi Shankar. And at the outset, I'd like to welcome all of you and thank AOS for this wonderful opportunity. So coming back to where we have left out earlier, we have decided on the autoclave, we have packed it, and now we have to sterilize. So most of the doctors, I think each one of you here should have faced an event where your autoclave has failed and you'll be wondering what to do. So this next talk is going to give you an overview of what are the things you should look when your indicators do not change. My presentation is going to be on two parts. The first part is what I'm going to talk about is troubleshooting the autoclave failures, and the second is validating the sterilization process. The second part is a video-based one, so I will start with my first indicator. So no financial interest in any of these indicators. The class 1 indicator, just to understand what a class 1 indicator is. See, most of you could have got your badges scanned when you came in. So it just shows that you attended the lecture. But it doesn't tell you whether you have been sitting here all throughout the day and you understood what has been taken. So a class 1 indicator just tells you that this particular load has gone into your autoclave, but it doesn't give you any information whether the load has been sterilized. So this is just a chemical on a piece of paper which changes from white to black once the autoclave process is over. But what you need to understand is that the temperature change can happen even at 50 to 60 degrees Celsius. It need not be 121. So just because the temperature, black color has happened, it doesn't indicate that 121 degrees Celsius has been attained. So this is the point you need to keep in mind. It just tells you that this particular load has been processed. So what happens when you see even this load has not changed color? It simply means that the temperature has not built up, there's a faulty electrical supply, or there has been a lot of air inside the chamber which has prevented the steam to come in contact with the load. So these are basic things. So next comes the class 2 indicator. This is the Bowie-Dick test. A Bowie-Dick test has to be done in any horizontal or a class N and a class B autoclave. In a vertical autoclave, the role of a Bowie-Dick test is obsolete, because it's a vertical autoclave, and whatever you do, there'll be a residual amount of air inside these autoclaves. So what happens when the Bowie-Dick fails? It simply means that there has been an air leak, the air has got back into your chamber after your vacuum has been attained, or an inadequate air removal, or the steam has not penetrated inside because of the air presence. So Bowie-Dick simply means that there is residual air inside your chamber. So this is how a Bowie-Dick changes. There are different colors from different brands. It's from white to black or from yellow to blue. So it doesn't matter, but the only thing is that the change in color has to be uniform. As you see, the one in the middle, the center part has not changed color. So this means that the Bowie-Dick test has failed. The change in color has to be uniform throughout the test. So as I told you earlier, look for any air leaks if your Bowie-Dick test has failed. Check for all the steam, because the steam might sometimes condense. We talk about the steam autoclaves. The quality of the steam is also very important. The ideal quality should be a saturated steam with a humid content of 80%. Oversaturated and undersaturated steam will not function. If the steam is undersaturated, it means the water content is not there. And if the steam is oversaturated, it leads to wet packs. So the ideal steam quality should be around 80% of water content inside your steam. So sometimes the Bowie-Dick packet set might be faulty, so check for the expiry date and the storage conditions. Sometimes when your Bowie-Dick test fails, you can run a warm-up cycle, which simply means that you run a warm-up cycle, don't wait for the dry-up time. Once the 121 degrees Celsius has been attained, you can switch off the autoclave and then run your Bowie-Dick test. So sometimes the incorrect procedure, the most important thing we tend to forget while we do the Bovidic test is that the Bovidic test has to be run in an empty chamber. Suppose if you're going to fill up the chamber, there'll be some amount of air which are trapped between the goods, and it leads to a failure of the Bovidic test. The Bovidic test has to be done on an empty cycle, the first cycle of the day, before you start loading your instruments. The class 5 indicator, which is actually an integrator. Why is it called an integrator? Because it takes into consideration the time, the temperature, and the pressure. Only if all these 3 parameters have been attained in the autoclave, a class 5 integrator changes color. So what do we do when a class 5 integrator doesn't change color? There will be a packing error. We tend to put a class 5 integrator into multiple packs and pack one over the another. In these situations, the steam does not reach the indicator, and hence the indicator fails. So stacking and overloading and package is one of the commonest source. You have to allow adequate space so that the steam can penetrate all around the packs for the class 5 integrator to change. The other most important one is the malfunctioning of the instrument, which normally happens. So you should have testing conditions, a validating process for your vacuum pump, ensure that it functions well before air to be removed. The next one is the class 6 indicator, which actually be used whenever we use any hollow or porous instruments. This simply indicates that the air has been removed inside of phaco tubings or any hollow instrument. How does this class 6 work? What is the principle? I'll be telling you in the next video. So helix checks can be negative when there's an insufficient time and temperature of your steam. There are air pockets inside, and your valves do not function properly. So solution is to check all this and ensure that they function well. The biological indicator, the common question we come across is how frequently should we use a biological indicator? See, according to the US ANMI norms, every cycle should have a biological indicator, because this is the only indicator which tells you that the entire load is sterile. But because the biological indicator can be read only after 48 hours, and we have to do your surgery. So in this situation, the class 5 integrator results normally matches the biological indicator. But even then, in Indian scenario, it is not practical to have a biological indicator for your every load. So normally, the practice which we follow in the Indian scenario is that depending upon your volume, you can decide the number of biological indicator you want to use. Wet packs, I think every one of us could have seen a wet pack in your sterilization. So wet packs, a wet pack is an unsterile pack, very simple. So when you have a wet pack, it can be classified into 2 types. Wet packs where the moisture is outside the pack, and wet packs where the moisture is inside. When you have a moisture outside, 80% of the time you will have a few droplets settled on the outside of the pack, which is absolutely normal, which gets dried up with your proper dry cycle. But the main problem is that when you have your moisture inside your packs, it is a big headache, because these do not get dried up with a normal dry cycle. The reasons are improper packing, poor steam quality, overloading your packs. The items has been wet before packing. Sometimes our staff, they do not allow adequate time for the hollow instruments for the moisture to dry up. And when you pack them, when they are wet, it leads to a wet pack. So how do you troubleshoot? The normal errors are overload, wrong cycle, and improper handling. Ensure that these things are taken care, and the wet packs do not happen. So it could be a component failure. The recommendations are check all the steam traps inside the autoclave, check your valves, make sure your vacuum pump is functioning well, because it's the single most important instrument which depends your cycle whether it's been successful or not. So ensure your vacuum pumps works well before the autoclave and after the autoclave. Before the autoclave, the vacuum pumps sucks the air, and after the cycle is over, it sucks the steam out. If the vacuum pump is not functioning well, it leads to residual steam inside your autoclave, which condense over the packs to result in a wet pack. The steam quality, as I told you, saturated steam with 80% water content is the best steam that is available, and always use distilled water, because that is the best source of water. When you use hard water or very soft water, this saturated steam will not be attained. So as I told you, wet pack troubleshoots, improper storage, take your load out of the autoclave, and storing is very important. and do not stack the load above. Normally, we do not give importance to the place where we store our material, as Dr. Nirmal had said. Physical parameters monitoring in the CSSD storage area is very important. These are the references, and thank you. So with that, I will go to my next part of the talk, and then we would be happy to take your questions. Can you please run the next video? No, not that. Okay, now we come to the most important part. So this video tells you how all the validation has been done. So once all the instruments are cleaned, they have to be packed individually in each set. And you can see how the staff is putting the class 1 indicator over every tray. So this is the class 5 indicator which goes inside every tray. You can see how loosely the instruments are packed. We use the plastic paper pouches, and they has to be sealed with a medical grade sealer, which gives you 3 to 5 mm of sealing. Do not use the normal sealant which comes across. Use the medical grade sealant. And it's always a good practice to stack the instruments vertically, because a lot of studies which have shown that when you place these instruments vertically, the steam penetrates all. This is a biological indicator. It contains 2 vials, a glass inside and outer silicone covering, which contains a broth and the bacteria, which is the Bacillus turcothermophilus, which is the most heat-resistant bacillus. So one of it has to be packed the way you pack your instrument, and it has to be kept in the most part of your autoclave. This is the Bowie-Dick test. As I told you, it comes in 2 forms, the paper or the strip. Depending upon your volume of your autoclave, you can use the strip or the paper. They have to be kept under a stack of linen. They have to be packed tightly, and they have to be kept inside an empty autoclave, as I told you earlier. When you place these, the load, ensure that it does not cover the drain, because that might cause a failure. So run the cycle. You need not have to wait for the dry time. Once the 121 Dick saturation is attained, you can remove this pack and inspect the Bowie-Dick paper to ensure that there has been a uniform color change. Once this is done, your autoclave is ready for the other loads to be taken. This is the strip. So a Bowie-Dick test basically ensures whether the air has been removed. This is the troubleshooting of an Bowie-Dick test, and which I already discussed. When you have an air leak, unwanted condensation, a faulty pack, the Bowie-Dick test fails. So these things has to be kept in mind, and if you have a faulty Bowie-Dick test, look into it. The class 6 indicator is the PCD test, otherwise known as a process challenge device. This is based on the fact that air has to be removed from a hollow tubing. This consists of a 1 meter long tube with a 0.1 millimeter lumen with a case at one end. Note how the strip has been folded. This is the way it has been folded, inside out and not outside in. Then the strip is placed inside the housing, which is then screwed out into the housing here. Then again, this tube has to be packed the way you pack your instruments to simulate the exact way your instrument has been exposed to the steam. These has to be then sealed with a medical grade sealant, and then has to be placed the way you place your instruments. Basically, you have to ensure that the helix test also undergoes the same process. It can also be placed inside your linen load if you want to test your linen. Then the bin has to be placed inside the autoclave as shown here, and then you run the cycle. If you're using individual trays, ensure that the trays go inside the autoclave in the vertical orientation, which ensures adequate steam penetration around the trays. Then you run your temperature 121 degrees Celsius for 15 minutes. And this is a troubleshooting. So whenever there's a change in color which has not been uniform, these are the things which you have to form. So the take-home message is that if you have a linen and a porous load, use the Bowie-Dick test. Hollow instrument, always use the PCD test. So now the autoclaving is over. Once your nursing staff opens up the bin, ensure that all the indicators has been checked to ensure that the proper sterilization process has occurred. Here you would see the staff checking out all the things. So these are all the class 5 integrators which has been placed in each trays. Do not use one indicator for 5 trays. Place a class 5 integrator inside every tray. And it is not needed that the entire window has to change color. Even more than 50% of your class 5 integrator has changed color, you can go ahead and use the cycle. The biological indicator, the way to use it is very important. As I told you, there are 2 vials. One is processed inside the steam sterilizer and the other is kept outside. So after the sterilization cycle, this particular indicator is taken. As I told you earlier, the inside glass pipe has to be broken so that the bacillus stercothermophilus mixes with the indicator, and the unsterile one or the one which has not been sterilized and the sterilized one, both are processed inside the biological indicator incubator for 48 degrees Celsius for 57 degrees Celsius for 48 hours. And after that, you would see that the vial which has not been processed changed color, which shows that the bacteria has grown, but the other vials, the bacteria has been killed, so the violet color remains. Understand that this is the most foolproof mechanism which ensures that your load has been sterile. And after this, all the indicators which you have run, the Bowie-Dick, the class 5, the class 6 indicator with the biological indicator has to be recorded in a notebook as Dr. Nirmal has highlighted. So this is the entire process, how the validation of your autoclave process works. Thank you.
That was really wonderful, Dr. Kumaran. It's so exhaustive, and what I learnt, and of course the audience also would have learnt, is if you are perfect in doing your work prior to your surgery in any operation theatre for that matter, systematically in an organized way, things never go wrong, and you taught us so much this afternoon. Thank you.
Thank you. So we'll be happy to take any questions if you have. We have another 15 minutes to go. Please, sir. You can use the mic if you want. Okay, sir.
Who supplies this class 6 indicator? From where to buy? Like class 2 and 5 I'm using.
Okay.
This class 6, who supplies it?
So there are a lot of vendors available here. The one I use is from Medista from Bombay. So you can, they have a stock here. Yes, they have a stall here.
And this Bowie-Dick?
Yeah, yes, this particular vendor has all these validating indicators from class 1 to class 6.
Medista.
Medista, MEDISTER.
Okay, thank you. Can I get it in Calcutta?
Sorry?
Those indicators.
Yes, sir.
You can get it in Calcutta.
Yes, sir, you can get it, sir. See, now everything is available, so you just, see, I get it from Bombay because that's the place where I got my machine. So I just go to put a WhatsApp message to them and they'll send it to me in the courier. So it's very easy, sir. I think every person or any surgical store would be having these indicators with them. Or the person who is giving you the autoclave, selling you the autoclave itself will give you an idea where this has to be get. But to my best of my knowledge, most of the surgical stores would be having these indicators.
Now, one thing, how to sterilize the operation theatre you're talking?
Yeah, so this particular IC is basic on sterilization of instruments, steam sterilization. So how to sterilize or disinfect is the right terminology I would use for operation theatre. Is a different ball game on its own. So
Can you tell me in a nutshell that one all
see, the in thing now is the HVAC system, that is heating, ventilation, and air conditioning system is the way to go about. So we do surface disinfection with an aldehyde-free disinfectant, and then we would run the HVAC system 1 hour prior to the operation theatre, which could take care of it. We do not use the fogging or the fumigation because it has been outdated and the materials are found to be carcinogenic. So we do, to put it in a nutshell, surface disinfectant of all the walls till about 6 feet, and then we run the HVAC system which takes care of it. The HVAC system would not work if there is no proper surface disinfection. And the roofs, we do it once in a week. You did not do it as a routine.
What about this ultraviolet ultraviolet lamp that you mean?
See, the ultraviolet lamp can be switched on in between your surgical theatre days just to prevent humidity accumulation. The ultraviolet sterilizer is not good. Why? Because the dose of sterilization needed varies from different organisms. It is not the same for every organism. And normally in most of the theatres, the UV light is put on the ceiling or on the walls. Okay? So there is no way to prove that the luminosity or the intensity of the light reaching the center of the table is uniform. You got my point? And there is no way to check the life of a UV light because they say 10,000 hours, but sometimes it might not even come for 2,000 hours. So you have to spend on a luminosity intensity meter to check whether the luminous intensity is correct every time you switch it on, which is not practically possible. So because a UV light would not work just for these two reasons, because different microorganisms have different lethal point for the UV, and there is no way to validate the intensity of the luminosity in the entire room. You have a 400 square feet of operation theatre, you have to put so many lamps around to make sure that your operating table has the correct intensity. So this is the reason why a UV light would not work.
Is there any mathematical calculation, say for a 400 meters square operation theatre, how many UV lamp has to be fitted?
So you will have a biomedical engineer who would calculate these things for you. But it will not be practically possible to put in so many amount of lights into the room.
Now, what we do, after finishing our regular schedule, after washing the air with
So you have a HVAC system or a not HVAC system, OT, sir? Yeah, so if you don't have a HVAC system with just a single split air conditioner, surface mopping is the best. And probably you have to clean your...
that will do it for sure.
Yeah, you have to do it before your theatre and after your theatre also in that case. So to the best of my knowledge, my opinion, these air sterilizers would not work because there is no proper validation to ensure that these sterilizers work well. It is not just an air sterilizer. The capacity of the air sterilizer has to be calculated by your AHU specialist, who calculates the amount of air coming into your theatre and the amount of air going outside. Only then an air sterilizer will work. So these makeshift air sterilizers do not work that way. It's an offbeat topic, so any other questions regarding to the sterilization process?
Sir, I wanted to know, once we sterilize the instruments, for how long can we wait for the surgery? Like, if we have planned surgery for the next day, can we do the sterilization a day prior? And how much time, within how many hours the instruments can be used?
So this question is pertaining to steam sterilization, I guess? Yes. Okay. So there has been a lot of studies for this particular question, but the real dictum is that there is no one answer for this question. To just take it forward, if you retain your instruments inside your autoclave and you have not opened it, it is sterile till you open it. So in case you are autoclaving the previous day night, okay, then you open it the next day morning, you can do it. Steam sterilization packs, if you're using linen, it has to be used immediately because the linen has a lot of pores in it, so the air tends to go inside. But if you're using the plastic paper pouches, which seal by itself once the steam goes inside, they can be kept for even till 6 months. There has been one study in the US which says that they can be kept for 6 months provided the physical parameters of your storage area is properly monitored. The pressure you have to maintain, room temperature, humidity, everything has to be maintained. Then you can even store up till 6 months. So as Dr. Nirmal has said, each hospital can form their own protocol. In my hospital, I do not keep it for more than 1 day or 2 days. So 48 hours is the maximum I can do it. So for my Monday theatre, I autoclave Saturday night and then I open it on Monday. Suppose due to some case I was not able to do the Monday theatre, I sterilize it. So there's no clear-cut answer. The number of days it can be stored depends upon your packing. Linen packing is actually being outdated. So I would always advise you to go for paper plastic pouches. And with this double packing, you can keep even up till 6 months, but you follow your own protocol. So ETO instruments, again the same thing, single packing for 3 months, double packing for 6 months. And ensure that if you're storing for 6 months, again I told you, the monitoring of the physical parameter is very important. So the edges of the paper plastic pouches should not be folded, it should not be damaged. So ensure you use a medical grade sealant. Yes, sir. Everything has been done. So all that I showed you, the videos which I've showed you are from my hospital, and for every theatre day prior to this, all these value indicators are being done.
So for drying of the instruments, can we use fan?
Okay, so for the drying of the instruments, there are 2 different ways you can use it. One, just wash it and allow it to dry. When you allow it, when you allow it to dry, it also depends upon the atmospheric temperature. Correct? If your room has a lot of humidity, then what will happen is all the humid will keep on accumulating over it and fungal growth will be there. So what I would recommend is, once you wash, use a high pressure air gun to remove the water content. And if you are not going to use the particular instrument, like our DCR instruments and our orbital instruments where we don't use them every day, we normally clean them, take the water content using a high flow air gun and put them inside a UV chamber, which keeps on running in, which maintains the temperature. And suppose when I want to use those instrument, I take it from the UV chamber, pack it and put it in the autoclave cycle. So never store an instrument in your room in an open cupboard. It has always to be kept inside a UV chamber. They are very inexpensive. They can be available in most of the major cities.
And what if we don't have that air gun?
You can use your dryer, which you use for your hair. The hair dryer can also be used.
Fan can be used,
You mean the ceiling fan?
or stand fan, or any?
It can be used. I would not say it need not be used, but a hair dryer is much simpler because you switch on the fan, you will never know when it's going to get dried up. But with this process, and you ask the sister to switch on the fan, they might come in 1 day or 2 days, they might forget. So with a handheld dryer, which most of us would be having in our house, that could do the job. Or if you have a high flow air gun, perfect.
In the tubings and the macro grow, you are using any fish water or flush the tubings? What do you recommend, sir?
So what I use is the high flow air gun, because we have a vitreoretinal setup. We also have a compressor. So you just have to attach a compressor with a handheld gun. No additional cost. This hair gun can remove the moisture inside these tubings instantly. So I have a video, but it is beyond the scope, so I have not brought that video. But use of an hair gun would do the job efficiently.
You said some surface disinfectant with aldehyde-free chemicals. Can you give a
It is not aldehyde free, it is formaldehyde free. Yeah, so what I use, there are different brands available. So what I use is the Aldi one. which has a concentration of 3% subglutaldehyde or something, which I'm not very particular. Now, what we showed is once the nursing staff opens up the bin, the first thing they should do is to see whether the indicator has changed color. That is what I was trying to say. All the indicators. But with a class 5 with the biological indicator, we cannot do that. So that video is just to tell you that everything has been changed. Okay. You can check the PCD test, that the class 6 test, I will call the helix test. If that has become positive, then it means that all the steam has printed inside your hollow tubings. Helix test. It's called PCD, or process challenge device. So basically, you are testing the process of steam going inside the tubings. So it's called the PCD test, or class 6 test, or the helix test. So it's a normal strip which you have to place inside a case which has a 1 meter long 0.1 millimeter lumen. As I showed you, so it's available. It comes in two forms. One's a silicon tube and one's a stainless steel tube. Stainless steel tube is one-time investment. Silicon comes to around 20,000 autoclaves.
So does the class B sterilizers damage the phaco tip? I mean, the company people claim that may.
Okay. Any steam autoclave would damage your instruments if you're not following the manufacturer guidelines. So before you autoclave your phaco tips, you always get the manufacturer guidelines of what a temperature you should use. What normally happens with the phaco tips is that rapid cooling and rapid heating. Suppose you have only one phaco tube and due to some reason it has become unsterile, then we have to do a flash autoclave. Flash autoclave by itself is an old terminology. It is no more used. It is called immediate use steam sterilization, that is IUSS. Here what we use is a temperature of 134 degrees Celsius for 5 minutes. So there's a rapid increase in temperature and then rapid cooling happens. In these situations, your phaco crystals and your sharp instruments will get damaged. So if you do not know all these processes, these people will take you for a ride. So in that case only you have to show all these indicators, all the auditing and the documentation to show that we have never crossed the particular temperature. Okay, if we don't have any more questions. Yes, it's a reusable tip. You can do that, sir. Is that your question, sir? Okay, I once again thank all the people for staying back here for your questions, and I thank my co-speakers, Dr. Ravi Shankar and Dr. Niranjan, for being a part of this wonderful IC. This is the second time we are doing it. Last time we did in Cochin, and it got reselected for the interest it was shown there. Thank you.